Hi, I'm Dr. David Tenner, and we're here at the Goldberg Clinic with Jenny Steines. And Jenny came to see us back in March of this year, 2015, and she's been working with us now for about 3.5 months. And so she's here for a re-exam, and she's going to share a little bit about her story with us. So, Jenny, do tell our audience a little bit about what brought you in initially.
I was physically and emotionally in a pretty bad place. Physically, I had horrible digestive issues, bloating, gas, and it was relating to joint pain, eczema. I was extremely tired, fatigued, low energy, depressed, just couldn't figure out what was going on with me.
Okay, and about how long had that been going on for you?
Probably 2 years.
About 2 years, okay. And what kind of help did you seek prior to coming to see us?
I went to my general doctor, I went to my digestive doctor, I went to dermatologist, and I went to OBGYN. And I really never got any answers, and it was very frustrating. And then I luckily found you guys.
Okay. Well, the scenario that Jenny describes in that regard is actually very common. A patient will have a variety of different symptoms, and in Jenny's case, digestive issues, eczema, which is a skin condition, fatigue, some depression, and some joint pain. And it's common for patients with these variety of issues to be seeing different doctors for each problem, right? So for the digestive issues, you might see a gastroenterologist. For the eczema, a dermatologist, like you mentioned. For fatigue, maybe a general practitioner, an internist. Depression, maybe a psychiatrist. Joint pains, maybe a rheumatologist. And before long, you're seeing 5, 6 different people and getting treated for 5 or 6 different things.
Absolutely.
And it can become tremendously frustrating for the patient, and oftentimes doesn't lead to good success. Now, one of the things I talked to Jenny about when she came in was that these issues that she was having were not likely separate and distinct problems. Now, they manifest differently, but oftentimes these things are all part of the same issue. All of these problems are interconnected. Okay, and I was confident that when we worked to identify what was causing Jenny's problems, what were the major factors, most of it stemming from what was going on in her GI tract, right, with digestion, that when that started to improve, everything would start to get well.
Yes.
Okay. So we've been working with Jenny for a few months now, and since we've been working with you, and you've been working very hard with us, what kind of changes have you noticed in how you feel and in your general well-being?
The changes actually happened really fast. I was surprised myself too. I totally dedicated myself. I was focused that I was going to do this to get better. I was so tired of being tired and not feeling well. I immediately saw the signs of clarity in my mind. I could focus better, I could think clearer. The fatigue started going away. I was sleeping better. The stomach problems started going away pretty fast too, where I didn't have the bloating. The bowel movement started being great, and slowly everything started coming together.
Jenny also in the process of getting well lost about 12 pounds too.
Yes,
and she,
I was never even here for weight loss, and we talked about this where if you're healthy, the weight just comes off.
It comes off
amazing,
naturally.
and it stayed off for me.
Well, Jenny's done very well with us. Part of the reason why she's done very well is that she's been very diligent and has worked very hard, has put forth a lot of effort. Now in about 3.5, 4 months in, we're starting to transition the process more towards Jenny now, where Jenny's going to now start taking care of herself for the most part. In the process of working with her and with all of our patients, the focus is always to help them get well, but at the same time, to teach them then what they need to do to stay well so that Jenny can then become master of her own domain, so to speak. So she doesn't have to be reliant on the gastroenterologist, the dermatologist, the internist, the psychiatrist, the rheumatologist, and all these different doctors that she had consulted with in the past, so now she can start taking care of herself.
Right.
And she can also become independent of us.
Yes.
Because again, as much as we like to see Jenny, we're very happy that she's doing well. We want her to be able to take care of herself. We feel that that's very, very important as part of the healthcare process. So Jenny, is there anything else you'd like to add in terms of your experience with us?
It's been fantastic. These guys gave me all the answers. I would highly recommend it to anybody and everybody. I've never ever gotten answers like this, and it was just amazing experience here.
Okay. Well, Jenny, thank you for sharing your story
No,
with us
thank you,
and our
guys.
audience, and we hope to continue the success moving forward, and thank you very much.
Thank you.